Let's talk about mortality. On a global average, 32 in 100 people die of cardiovascular diseases, 13 in 100 adults have diabetes, and 33 in 100 Americans have already been infected by COVID-19. The burden of such diseases in retrospect may seem endless, but your fate is not hopeless. As the World Health Organization once announced in its newsroom Q&A, 80% of premature heart attacks are in fact preventable, of which early and personalized detection of the high likelihood for one to contract the disease can make space for quicker action to be taken, ultimately saving precious time for the patient.
By taking advantage of the outcome of this World Health Organization research, Bionostics have created an easy-to-use and accurate prediction app for common diseases. With the training of 3 machine learning models being derived from open patient records, our technology can effectively predict diseases from the symptoms inputted by the user.
Our main competitor is Symptomate, another app that uses ML learning to improve healthcare access by outputting a disease that algorithms think is causing patient their symptoms. However, our main competitive advantage lays in the fact that we are here to help patients check up rather than serving as an alternative to medical assistance.
Our website includes 5 different algorithms: a diabetes predictor, a hospital finder, a monkeypox case visualization, cardiovascular disease predictor, and a COVID-19 predictor that are each used in a specific way to assist a user. Users input many different symptoms and numbers, including BMI, their general health on a scale from 1 to 5, gender, and age. We use a random forest classifier with over 100 trees. After our algorithm predicts if you have no diabetes, pre-diabetes, or diabetes, we give detailed information about the symptoms of diabetes and what to do next. Our current model can predict diabetes at a 90% accuracy. Our next algorithm is a hospital finder. Our algorithm to find the nearest hospital from your location utilizes various libraries and uses the Google Maps API. After the user inputs their address, we will use a geocoding software called Nominatum to find the longitude and latitude of your address. Then we use the Google Maps API to find the nearest hospital. The information returned from the API is once again in longitude and latitude coordinates. Finally, we use, again, the Nominatum to convert the longitude and latitude into an address. Our next feature is the monkeypox case visualization tab. Here, users can learn more about the distribution of cases of the monkeypox virus, which was recently classified as a public health emergency by the WHO. We offer many different visualizations, including the graph of cases and visualization of cases around the world using the Plotly library. The feature that makes our monkeypox algorithm so unique is that it automatically updates every day as new cases are recorded. Next feature is the cardiovascular disease detector. Knowing that this is the biggest killer in the United States with over 700,000 people dying annually, we knew that we could utilize our knowledge of machine learning to help diagnose this disease early on. Using publicly available data from Framingham, Massachusetts, we use a logistic regression model to predict if a patient will develop heart disease in the next few years. Our current model can predict cardiovascular diseases with an upwards of 87% accuracy. We developed a detector for COVID-19. Using categorical data such as problems with breathing, whether you have a fever, whether you have a sore throat, whether you have fatigue, we can accurately predict COVID-19 through a decision tree classifier with 98% accuracy.
All these algorithms are encompassed in a clean UI made possible by Streamlit. Streamlit is an open source app that allowed us to create the website. Thanks to Streamlit, the existing user interface, or UI, makes it simple for users and straightforward for users to navigate and choose from different prediction programs, statistics, and assistance in healthcare. It was essential in helping us code visualizations and a wide array of possibilities in a few simple lines, including integrating data into a visual map as seen in this monkeypox page. Streamlit works really well with sklearn and pandas, which are both integrated and used in our coding process. sklearn especially was essential in helping us generate the predict button below every prediction algorithms. Everyone at the community level will now have the technology needed to understand their own risks to a myriad of common diseases so that people can seek the medical assistance needed to protect themselves. That is the message and the scale of impact that we are sharing through the Bionostics platform. If you can know your own risk, then you can lower your own risk.